Today we meet Luiza Dobre, co-founder and CEO of Komed Health. Komed Health is the abbreviation for communication medicine in healthcare. Luiza, when you started your company, I think one reason was patient safety. Explain us, what do you think about this?
Yeah, actually, that's very true. 4 years ago, when I embarked on this journey, I realized that the third cause of death is medical error, and actually, 250,000 people in US die because of inefficient communication between different healthcare providers. And in Switzerland, where I'm coming from, 1,500 people, which for me was a shocking number. And then I tried to understand why is that, and I realized that the IT infrastructure in hospital is still in the 60s, 70s. Doctors and nurses are still using pagers, DECT phones, switchboards, faxes, as a matter of fact, and yeah, you know very well. And unsecure WhatsApp, which basically is putting the information of the patient in an unsafe place. And this is how we embarked on the journey with Komed Health.
So, and you decided to build up such a communication platform for doctors and nurses and other stakeholders in the healthcare system. How does it work?
So for us, it has to be very simple. And actually not for us, it has to be very simple. It has to be very simple, very intuitive for nurses and doctors. Then it has to be secure. And in order to provide really the value in a very busy day, it has to be integrated in the workflow. So in the end, it's a secure communication platform that can be easily integrated with the existing IT systems in the hospitals. In order, for example, to break down the silos between different departments and push the patient information on a smartphone, on a mobile device or web application in the moment that the information is available. So when you're a physician and you order a lab result or radiology report, instead of you looking for that information, trying to make several dozens of calls to know when that information is ready or go to your computer, you get this information on your handy telling you the lab result for patient Y is available, and this would be the preliminary result.
Luiza, a lot of doctors use WhatsApp because it's stable. Yeah? It's maybe the reason. WhatsApp is a part of Facebook, so we know the data security is not at its best. What is better on your solution?
So first of all, we build our solution in a way that is secure. So it's secure for the user. It's secure with it treats securely the data. We provide our application on the premises for a hospital. And also in the cloud, so we work with a cloud solution that is specialized with healthcare data. So at the moment we have hospitals in Switzerland and the data is in a cloud solution in Switzerland. When we are moving to Germany now, we will have a cloud solution in the German market. This is one way. The other way is how you maintain the healthcare data securely on a phone. And this also very much depends on the hospital strategy in terms of mobile strategy. So many hospitals now are even giving smartphones to their staff, or they have a policy, bring your own device. And then you are basically, as a hospital, you can decide which one of these two you adopt. And we have different security measures, the same as e-banking, like you can connect to the app via fingertips or face recognition or QR code, and the hospital decides how long the session can last. You also have other ways. For example, the hospital will decide, oh, we would like to have it only during the on the premises of the hospital, so in the Wi-Fi infrastructure of the hospital, but we do not recommend that because a doctor also, when he's home, he wants to be able to provide second opinion feedback to the teams in the hospital.
And the technology is integrated in the KISS system, and
Exactly.
it's one ecosystem.
Exactly. So we are a plug and play simple, secure communication solution on top of any Krankenhaus information system, so electronic medical record, right? This is how a doctor or nurse can take the best value from our solution. So it's great to have a simple solution, but it's even greater in the moment it's connected with critical patient data.
It was very interesting. Thank you very much. And dear doctors, don't use WhatsApp. Use technologies like this one we heard about. Thank you very much.